Hi everyone, it's Jasmine, and in today's video we are talking about high blood pressure, otherwise known as hypertension. Hypertension is the medical term for high blood pressure, which occurs when the force of blood against artery walls is consistently too high. This results in forcing the heart to work a lot harder to pump blood around the body. Blood pressure is recorded as two numbers, the systolic blood pressure over the diastolic blood pressure. Systolic is the pressure in the arteries when the heart is contracting, whereas diastolic is the pressure in the arteries when the heart and the vessels are relaxed. The most ideal and textbook standard of a perfect blood pressure is 120 systolic over 80 diastolic. While hypertension can often be symptomless, it is damaging if it's left untreated. Now, if we look at blood pressure ranges, a normal blood pressure, again, is around 120 over 80 or even a bit less. An elevated blood pressure can be 120 to 129 over a diastolic that's greater than 80. But when we want to diagnose hypertension, there's two stages. So stage 1 hypertension is when your blood pressure is between 130 to 139 systolic over 80 to 89 millimeters of mercury. And stage 2 hypertension is if your blood pressure is 140 over 90 or higher. And a hypertensive crisis would occur if your blood pressure reading is 180 over 120 or higher, and this requires immediate medical attention. Risk factors for high blood pressure include both modifiable risk factors and some non-modifiable risk factors. So when we look at the modifiable ones, it comes to poor diet, so a diet that's high in sodium, low in potassium, a sedentary lifestyle, so a lack of exercise or physical activity, smoking and alcohol use, obesity, and stress. When we look at the non-modifiable risk factors, these include age, your family history of hypertension, your ethnicity, as certain ethnicities are posed to a higher risk, and other chronic health conditions, for example, diabetes or potentially kidney disease as well. Symptoms and complications of hypertension. So sometimes people will have no symptoms. However, in advanced cases, you will see headaches, which is often the very first sign of high blood pressure, blurred vision, chest pain, dizziness, or even nosebleeds. And complications of these can include stroke, heart attack, kidney failure, or vision loss. What lifestyle changes can we implement to reduce our risk for hypertension? So again, similar to the risk factors, we kind of want to do the opposite. So for diet, we want to reduce our salt intake and increase our intake of fruits and vegetables. We want to exercise, and ideally what this means is at least 150 minutes per week of moderate physical activity. If you are able to do more, that's even better. Weight management, so you want to maintain a healthy weight. This can be done again through diet, exercise, and proper sleep. We want to limit our alcohol intake and avoid smoking altogether if possible. And then stress management is huge. So utilizing techniques such as yoga, meditation, or whatever works for you to decrease the level of stress in your life. Medications can also be prescribed for hypertension, but they should be prescribed when lifestyle changes alone aren't enough to manage the condition. Common classes of medications include diuretics, ACE inhibitors, beta blockers, and calcium channel blockers, which effectively just reduce the blood pressure in your vessels. It's very important that you have regular follow-up so you can ensure that the medications are being used properly and safely for your specific condition. This then leads into the next topic of the importance of monitoring and support. So if you do have hypertension or you just want to keep a closer eye on the health of your heart, tracking your blood pressure at home can be huge. Keeping regular appointments with your healthcare provider as well, as we just mentioned, to make sure medications and lifestyle factors are working effectively for you, along with involving family or caregivers in your treatment plan, can be very, very helpful in mitigating hypertension. There are also different apps and home devices that can support long-term monitoring and make sure you're on track with your diet, exercise, stress management, and medications, if applicable. Overall, if we look at some key takeaways from this presentation, it's important to note that hypertension is common, but it's also controllable. Early detection and proactive care prevents serious complications of the condition, and a combination of healthy living and, if needed, medication leads to the best outcomes. Thanks for watching.